We've spoken before about the potential benefits of proton beam therapy for lung cancer. Now, the benefits of proton beam therapy are a result of the radiation not affecting the normal tissues surrounding the lung cancer. So for patients who've got tumours that are next to the heart or the spinal cord, proton beam therapy can offer treatments that reduce the risk of potentially serious side effects of radiotherapy and offer curative treatment to people who've been told that that's not possible. It's also very useful for people who've had radiotherapy before. With traditional radiotherapy, sometimes offering treatment to a lesion that's already had radiation treatment can be very challenging. Proton beam therapy offers a solution for people who've been told that radiotherapy is not an option. Coming to have your treatment at Proton International London at UCLH might feel a bit daunting to some, particularly if you're outside of London. The first thing to say is you'll be supported every step of the way throughout treatment. I see patients before treatment to talk about the benefits and potential side effects of treatment, and then I review patients every week or as often as they need if they're having symptoms throughout that treatment course. For lung cancer, what would happen is you would attend and you'd have some scans. You'd have a CT scan and also an MRI scan to help us design and personalise the treatment for you. After that, there's a bit of a gap while we plan the treatment and make it as safe and also as effective as possible. That takes us a little while, and it's up to you whether you stay in London during that period. Now, the team at Proton International London want to make life as easy as possible for you. If you decide to come to London for treatment, they'll help you arrange accommodation, they'll arrange cars to help you get around and explore the city, they'll even arrange things like food deliveries to where you're staying, or they'll even organise theatre tickets. Every week you'll meet with a team of people, you'll meet with me, you'll meet with some radiographers who deliver the treatment but also check your symptoms every day and let me know how you're getting along. And if you need any help from any other healthcare professionals such as dietitians or physiotherapists, we can arrange that while you're here with us. Some people tell me that on the first day of treatment, they can find the equipment that we use to treat you a bit daunting. Now, to reassure you, here's what the machine looks like. You'll see there's a couch that you lie on, and there's also the machinery that delivers the treatment in the room with you. There's always people sitting just outside the room and they're watching you, and you can communicate with them at all times. If you ever need some help, if you're ever feeling uncomfortable, or you just want to ask something, they can be with you in a couple of seconds. The machinery moves around you to deliver the proton beam treatment, but it never touches you. The machine moves with millimetre accuracy, so don't worry that the machine will ever get too close. We've tested all of this long before you ever enter the room to receive the treatment. Now, the treatment is invisible, you don't see anything, you don't feel anything, there are no funny noises, and actually we usually play music for people to keep them relaxed. Having lung cancer and needing treatment, particularly if you've been told that that treatment might be challenging or high risk, is incredibly stressful. It's our job to take responsibility of your treatment and to make that treatment as easy and as stress-free as possible. If you've got any questions about proton beam therapy, do get in touch. And if you've been told that you can't be safely treated by your doctor and they haven't spoken to you about proton beam therapy, please ask them why not.